In today's video, we're going to look into information as to what medical conditions activation of the vagus nerve has ever been studied. Basically, what diseases or conditions have this type of medical therapy where you activate the vagus nerve been looked at in terms of helping people that are afflicted by a variety of different conditions. So we're going to look at what these conditions are, what are the top best ones, and I'll tell you right away the top 10 list I've made, and also the safety profiles. And just to let you know up front, the top 10 list that I've made based on studying this paper are the following: depression, heart diseases, stroke, epilepsy, migraine, tinnitus, insomnia, recovery from coma or help with disorders of consciousness, fibromyalgia, and COVID-19. Okay, so the reason why I was curious about this paper is because I wanted to especially look at what are the safety profile. So let's get started. My name is Dr. Mikhail Rashek of Neurogenomics, and before I get going, I want to let you know that this video is sponsored by Nurosym. It's a company that makes vagus nerve neuromodulation device that is approved for medical use in Europe, called Nurosym. And we'll talk about this company and their science as well later on in the video, so stay tuned. And if you're afflicted by any of the conditions, our top 10 conditions I've already mentioned, then also stay tuned for more information. So the overall summary, if I can tell you, is that this vagus nerve neuromodulation seems like a very promising new therapeutic tool available to doctors. It's a very new emerging science, so that's why we say promising. It needs further studies, but as you'll see in a moment, this is new field that is exploding rapidly. And the reason why it's capturing so much interest is because it seems to be working effectively for many different conditions. The authors mentioned that 21 different conditions or diseases have been investigated this way. And some of these conditions are like they have completely unrelated causes. So that's what makes the vagus nerve so interesting, because it seems to be working. This shows you how the vagus nerve seems to be such an underlying biological feature that for the benefit of our health. That's why I'm also so interested in it. And it appears to be quite safe and tolerable, and it's very vagus nerve neuromodulation. This is non-invasive, meaning it's not being injected or put in surgically into your body. This is something you can do externally on your body. It's very easy. As a consequence, it's very easy to use, and it's quite affordable compared to the potential cost of treating some of the conditions we'll discuss. So moving on. Of the 21, what did they do is the authors basically looked at all of the studies published where vagus nerve neuromodulation was looked at populations that were sick or had some condition that was being investigated ever. And in total, they found 109 studies that included 104 published studies plus 5 abstracts. So what does that mean? Abstracts are basically abstracts from conferences where people present posters on their latest research. It hasn't made it into a publication yet. Sometimes these abstracts of the posters themselves are being published in scientific journals as well. So 109 scientific documents, if you will. Okay. So the very first figure they showed, the very first thing you see, what are the 21 different areas of health. So check that out. Again, if you're anywhere in those conditions, then this might be of interest to you. And you can see the top one, the area of health that has been investigated the most is psychiatric disorders. Depression happens to be the one that was investigated the most. So there you go. Like it could have also involved other conditions besides depression as well. So those are basically the top ones. Now, where the limitation is that how many number of participants have been investigated so far, and that's not that high. It was just over maybe 2,200 individuals participants who were studied with the vagus nerve neuromodulation in comparison to about 1,000 individuals in controls, or the sham. So those who received what is basically like a fake treatment. Now, before I continue, let's talk about that. What is the fake treatment? Basically, almost 50% of the time, what happened is the device, the vagus nerve neuromodulation device, would be clipped somewhere on your ear, because this is all of this is based on targeting the auricular branch of your vagus nerve, meaning the branch of your vagus nerve that descends into your ear and innervates your ear. And half the time people would clip the device somewhere where the vagus nerve is nowhere near, and then you can activate the device, but clearly you're not going to touch the nerve, so it doesn't work, right? And the other half of the time they clipped it to the same area where the vagus nerve is, but they either did not introduce any electricity, number one, or number two, they introduced electricity at extremely low frequency, meaning the zapping of the skin was like very infrequent, very seldom. Or number three, they introduced the electricity, meaning they activate the vagus nerve, but only for seconds, as opposed to typically the duration of treatment typically is quite long, many minutes, and we'll discuss that in detail as well. So those are the shams. So you can see some of the shams actually led to activation of the vagus nerve, but for extremely brief period of time. All right, so that's 2,200 people who received actual therapy, as opposed to about 1,000 people who got that placebo or sham, okay? So why is that limitation? Is because we would want these numbers to be at least 10 times higher. I gotta tell you, I would prefer this to be even 100 times higher than that, okay? So that's the unfortunate part, but it also signals that this is still an early stages of investigation via this type of medical therapy. And remember, I mentioned this in one of the previous videos. Basically, this is a new field of medicine called bioelectronic medicine. Okay, then this is why as you'll see right away in the next figure, it's really capturing attention, because all of the studies, the first study that used this type of method for helping people treat conditions was only in 2012, and they found studies up to end of November of 2023, and this is when they started working on the publication. And you can see that out of the 109 studies that they found, about 75% of them have been published in the last 4 years. So clearly you see this growth of interest in this type of intervention. So very interesting pattern. You can see that it's really growing, really capturing attention. But we are still at its infancy, still at a very early stages of learning about how to use vagus nerve neuromodulation for medical purposes. So that's one figure. Then you can also see on the other side of that same figure, you can see that the vast majority of the published articles happen to be randomized clinical trials. That's really good, because those are considered to be the highest level of scientific evidence whether something is working as a proper medical intervention or not. So this is really good sign as well. Moving forward, they mentioned also that overall 26 different devices have been looked at. So that's a lot. And you can see the second one most studied ever so far is Nurosym, which is actually amazing. The reason why is because Nurosym, which is the device built by Nurosym, is fairly recent. It's it's a new kid on the block compared to the other ones, and you can see it's quickly catching up when it comes to scientific prowess. So that's really good. We want more studies, obviously, from Nurosym, scientific studies, because this is how you build the reputation of quality and how well it works. So this is really good. And I can tell you that there's been more studies, obviously, since then published, because I've already done 2 videos, or at least two videos on some of their studies with that particular instrument, which is not included in this particular review that we're discussing today. So that's cool. And then you can see also the most common way of using vagus nerve neuromodulation is via ear clip. So it's just like exactly like what we see with Parasym. All right, now in terms of what you need to do in terms of vagus nerve neuromodulation, there's 3 parameters that are important, and the authors mention the scientific publication is quite inconsistent in reporting these parameters, so much so that it did not allow them to really be able to determine what parameters might be working more beneficially than others, which is was one of the author's interests. This is a limitation of this field of science in general right now. That's still, it's because it's too new. But what are the 3 parameters? There's 3 parameters. One of them is the intensity of the electrical current that you're going to be zapped with. So typically, they mentioned that for the majority of the studies, this did not exceed on average more than 6 milliamps, okay, of current. So this is how much current is being zapped into you to hit the vagus nerve. Second parameter is basically the duration time of each zap, every time you send the current, how long do you send the current for? And typically, the vast majority of studies, it was somewhere between 0.05 to 0.1 milliseconds. So extremely quick. It's like bing, super fast, okay? So, and then the last parameter is how frequently you're going to repeat this within one single second. And that's measured as hertz. Hertz basically measures how many times something happens within 1 second. And again, majority of the studies were somewhere between 20 to 25 hertz of all of these studies, okay? All right, so then, but again, that's still a limitation. Now let's talk about the conditions. The big part of the review is to talk about different conditions. The way I decided to review it is basically see which ones made more sense to me as top 10. And let's discuss them very briefly. And then, as I mentioned, number 1 is depression, because 11 out of 11 studies showed improvement in whatever symptoms were being measured. Second was cardiac disorders, with 9 out of 9 studies showing improvement in whatever they were measuring. Then third place was stroke, with 9 out of 9 studies showing improvement. Then fourth place was epilepsy. I believe this was 7 out of 9 showing improvement. Next one was migraine, with 6 out of 6 studies showing improvement, followed by tinnitus, which I believe it was 4 out of 5 papers showing improvement. Then both insomnia as well as recovery post-coma, 4 out of 6 papers showed improvement. Then fibromyalgia, 3 out of 3 papers showed improvement. And then COVID-19 papers, 3 out of 4 papers showed improvement. Now, COVID-19, it's interesting because one of the improvement, 2 of these 3 papers, one of the improvement measures that they were looking at was recovery of the depression, so improvement of the depression symptoms. So here you go, more data showing how effective neuromodulation is for depression. And we did do a big video on that as well. Last video just focused on the latest scientific information, clinical trials just related to depression, so check that out as well. And also I did 2 extra videos on COVID-19 papers. So there's 2 more papers that have came out, and this paper is from 2024, so it's this year. But since then, 2 more studies have already come out showing that improvement with COVID-19 measures as well. That's actually using the Parasym device that we've been talking about as well. So clearly more data is accumulating as we speak. As you can see, based on the trend, every year there's more and more studies analyzing how can vagus nerve neuromodulation be used to assist medicine. All right, so and the one more that I'll talk about is tinnitus, and we'll talk about it right away when we get into the symptoms. But before we talk about or side effects, I should say, before we go to side effects, one more thing, the authors did conclude that there is now building evidence that different parameters of how you use the device might affect outcome, meaning might influence positive outcome. And the overall generalization is that you need to use the device longer rather than shorter duration of time. The vast majority of these studies looked at time spent somewhere between 30 minutes to 240 minutes. That's 4 hours in a day. And the shortest one reported was about maybe 20 minutes. The longest reported in this paper that I saw was 360 minutes. Imagine 6 hours of stimulating your vagus nerve somewhere around your ear. And we'll talk about that, how that might be impacting the side effects that were observed because of that. And duration is typically few days till 7 days a week. So this is a lot. And then the shortest studies were only a few sessions, literally just maybe the device was used only a few times. The longest duration, most of these were somewhere between 4 weeks or more, and the longest duration of all of these studies was even a year and a half. So you can see that if you're trying to help yourself with symptoms we're discussing, and of course if you were to do this and you belong into one of these populations, of course do it under doctor supervision, then you can see that longer period of time might be far more important than a shorter period of time. Now this brings us to the side effects, and overall they said that in terms of the adverse events, the reporting of that was very inconsistent, it was limited, and overall their conclusion, it's still very poorly studied scientifically. So that's a limitation right there, okay? So, but just over 50% of the papers reported some information on side effects or adverse events. So about 57 papers did discuss it. And out of those 57 papers, 30 said there was nothing was observed. They were looking for side effects and none were observed. That's very, very cool. Of the other 27 papers, at least one or more side effects were observed, including some, about 9 of these also reported some serious side effects. Now, the vast majority of the serious side effects were considered not to be related to the device use at all. Remember, we're dealing with sick populations, so there's obviously some people can obviously exhibit illness or effects that might be absolutely not related to the treatment, and only about 5 instances of serious side effects were considered to perhaps possibly be related to the use of the device. So the overall message is that the side effects, severe side effects, are considered to be extremely rare, and this seems to be a very safe and effective method of treating people. Now, we've heard this before. What does that mean? Safe and effective means that there is no information available for anything long term, really. And again, that's very common in medicine. We often miss the information for long-term effects. So that's for the side effects. Now let's take a look at what the side effects are. You can see the vast majority of any side effects were localized, meaning they happen to be at the site of where the vagus nerve was being stimulated. That perhaps is not a surprise because of the amount of time. Remember, some of these people were stimulating vagus nerve for multiple hours per day. So the vast majority of the side effects happen to be localized on the area where this electrical stimulation took place, and the redness of the skin was the most common side effect. This was followed by dizziness and headache, followed by pain at the site of stimulation. Now, I've experienced that as well. When I use the device for longer, you will literally feel like the side of my ear is a little itchy because of that. And then the last one is also fatigue. Now, what's interesting, very few studies looked at the level of intensity. About 10% of studies that did talk about side effects, they talk about what was the intensity of these side effects, and they report them to be mild to at most moderate. And the duration of side effects almost never reported. Only 2 studies ever talked about it, but in terms of how long these side effects last, they last from anywhere, most often less than an hour, up to 6 hours. So they're just very transient. So at least that's good. Now, in terms of side effects, notice that some of these side effects are also the conditions or effects that also people use vagus nerve neuromodulation in order to get rid of the very same problem. We discussed that in one of the past videos. The only one that I'll mention is that notice another common side effect is increase of tinnitus, as well as in one instance tinnitus happens. So just wanted to mention that because I did talk about that vagus nerve neuromodulation has been used successfully for improving symptoms of tinnitus, but remember there is also the potential side effect that it might also make the situation worse, perhaps temporarily. So just a warning right there on that account. But overall, the authors conclude that this is very interesting, emerging new medical approach to helping people with therapies that should be studied much further. However, take the conclusions of this review with caution. This is information for doctors, and the reason why is because this is just still so new and we need a lot more information to understand exactly how well and how effective this can be in terms of the arsenal available for doctors for helping their patients. But here we go. And one more thing that I wanted to let you know before I wrap this up is this was in the introduction. It was the author's explanation as to why vagus nerve neuromodulation might be working. And I liked it because there's a little bit different spin on things, and they mentioned it in a following manner that the vagus nerve neuromodulation can activate both noradrenaline pathway as well as cholinergic pathways. Those are biological metabolic pathways or hormonal pathways and so on in our body. But the take-home message is that both of these are involved in shaping or influencing neuroplasticity. I always have an issue with saying that word. And the way they summarize it is that basically vagus nerve neuromodulation appears to be changing the chemistry inside the brain so that it makes the brain more likely to be able to change. And this is how they were saying that perhaps vagus nerve neuromodulation could be, at least in terms of from the context of the brain, could be helping in terms of improvement of these symptoms. So that was really very interesting, different angle of describing it than I've seen before. All right, I'm gonna wrap it up right here, and let me know what you think if you're using this. Clearly, it's very exciting times because we are at the new start of new medicine, and it's fun to be reporting on these issues. Take care for now, and see you later. Bye, everyone.